I'm Sophie Nordmark. I work at the National Board for Health and Welfare and I'm the project manager for the Swedish part of CIRCE-JA. In the project CIRCE-JA, Sweden chose to transfer and implement the Spanish healthcare model for remote patient monitoring, which has shown good results in Galicia. The National Board of Health and Welfare participate in collaboration with Region Norrbotten. Norrbotten is the northernmost region of Sweden's 21 regions. With its slightly more than 98,000 square kilometers, it covers a quarter of Sweden's total area. It is home to just under a quarter of a million inhabitants, which means extensive sparsely populated areas and long distances. On average, 25% of the residents are older than 65 years. There are 14 municipalities in Norrbotten County, and Region Norrbotten has 5 hospitals and 24 primary health care centers. Most of the municipalities have only one primary health care center in their care catchment area. In the region there are also 6 private health care centers. Within the project CIRCE, Region Norrbotten started in 2024 with pilots at 4 of their primary health care centers, and then slowly scaled up to 9 last year and plans to continue implementation at the remaining 15 this year. Patients with hypertension, heart failure and diabetes type 2 are included. And depending on their individual needs, blood pressure, pulse, weight and blood sugar are measured in combination with assessment scales and questionnaires. In 2024, 266 patients had been registered in the monitoring system. Last year it was 375 and they're aiming to 1,000 patients this year.
My name is Camilla Brännström. I work as a business area manager at Region Norrbotten. Because of the long distance, it can be difficult to offer local service, including healthcare. Because of this, we need new ways of working. Digital solution and distance care are important to make healthcare equal, accessible and safe. The goal is to increase patient involvement and improve access to primary care. Patients should get help earlier and more easily.
Hello, my name is Stefan Karlsson and I have the role as a team leader for the region's IT and medtech strategists with a focus on digitalization and development. We can see several major effects with the broader introduction of these services, such as early detection of health problems, more efficient use of resources, increased patient engagement.
My name is Martin Myrhag. I'm a district nurse and a diabetes nurse at Gammelstaden Healthcare Center in Luleå. Also in the beginning trying to create good routines and a good workflow is challenging. For example, trying to estimate how much time you need to set aside each week to monitor a patient is not easy in the beginning. To have in mind that this is a work in progress, we learn and adapt as we go. In the beginning, sometimes we had a focus to try to get the system up and running with a lot of patients, but it's important to have in mind that it takes time to create good and functional routines. It takes time to create a good workflow, but also it takes time for both the patients and staff to get used to the system. Also, it's important to have good communication and training for both patients and staff. And as a monitoring unit, it's important to have continuous follow-ups and evaluations so we can improve our work. I think the care model for remote patient monitoring has given patients an increased involvement and also more control over their own health, which many appreciate, and I think it gives them a sense of security.
We have an ongoing project where we are integrating the remote monitoring system into the organization's EHR system, so it becomes a part of the healthcare operations toolbox.
The next step is to scale up the implementation. The working method should become a part of the daily practice across the organization.
The authorities' previous survey showed that the regions have difficulties in moving from small, limited projects to the broad introduction of remote patient monitoring. And based on this project's lessons learned and our results from the follow-up research, the goal is to develop a guideline that will support the regions to reach a sustainable implementation of remote patient monitoring.